Indeed. Thank you very much, Kuhlia Adams, for that look at the weather. And of course, time for us to delve into the conversation of mental health during the lockdown. And if you thought you were the only one feeling more stressed and anxious than usual, know that you are not alone. A recent study conducted by the South African Depression and Anxiety Group SADAG suggests that 55% of South Africans had feelings of anxiety and panic since the national lockdown started on the 27th of March, and 46% were under severe financial stress and pressure. Now, the largest mental health advocacy group in the country has also seen a tremendous increase in the number of calls to their mental health helplines during this time. SADAG spokesperson and operations director Cassey joins us on the line this morning to tell us more. Cassey, good morning. Thank you so much for making the time.
Morning. Thank you for having me.
Cassey, let's talk stats now. How did the number of calls to SADAG's mental health helpline differ from before, and what's it looking like now during the lockdown?
So before lockdown, we were averaging about 600 calls per day from people throughout the country. And then since lockdown, we've been monitoring our calls very closely on a daily basis. We've seen a huge increase. Our calls have doubled since lockdown. We're now getting over 1,200, 1,400 calls a day from people who are feeling really anxious, really overwhelmed, and just really worried about the future. But it's also great that so many people can reach out. Our worry is how many people don't know about SADAG or who aren't reaching out during this time.
I certainly can agree with you there. I think it's very important that we note that the fact that people are calling in those numbers speaks to the fact that they are aware that there is help out there available and that you guys are doing such fantastic work in that regard. But what are some of the reasons, the main reasons people are calling into your mental health helplines? What are people struggling with the most during this time?
You know, it's a combination of different issues. You know, no South African is immune to the effects of lockdown and COVID-19, but the impact has really been huge. People are calling in because they're anxious, having panic attacks, worried about their jobs. Are they going to have enough money? Are they going to be able to pay for food? How are they going to cover debt? What's going to happen? Will they be able to get medication? So it's normally a combination of issues. And as you mentioned from the survey, we're seeing that people are calling in mainly about anxiety and depression, financial stresses and pressures. So whether it be, can I afford rent? I'm being kicked out, how to get a soup kitchen or a food parcel. And it's just really an overall sense of being overwhelmed. We are still also getting people who are feeling suicidal, and we're still having to assist patients with acute mental health care.
And I know that you've also been focusing a lot on delivering some really interesting webinars that you've been hosting. What are some of the topics that you discussed there, and how can people be a part of it? How can people empower themselves with the right knowledge around mental health through these webinars?
So during lockdown, we've seen a big spike in the number of people reaching out online or wanting to get information online. We've been hosting daily Facebook chats with experts every single day, covering all kinds of topics, from dealing with unemployment to helping your children cope with anxiety, to even how to look after a loved one and look after their mental health. So we've done topics every single day. We've had more people reach out to us on WhatsApp. This Friday, for example, we're covering the anxiety and the stress about being an expectant mom or a new mom during COVID-19 and how to handle the anxiety and depression around that.
Cassey, this is such an interesting thing that you're doing there, but also such an interesting time that a lot of people are finding themselves in. I imagine that you are getting a lot of phone calls from young people, younger groups of people who are particularly stressed about the academic balance, matriculants and as well as university students. Is that the case at the moment?
It is. You know, SADAG does a lot of work with different universities where we support students at universities around the country, and I think it's an incredibly stressful time. We're also having calls from parents who are worried about how to help their child cope with anxiety and the stress and the uncertainty that is around schooling. I know we've just had the recent announcement, and I think it's just to kind of manage through that. But we've got lots of students who are unsure about their future, their options, what the next steps are. And that's an overwhelming pressure. I think for every South Africans, we're feeling overwhelmed by by the uncertainty, the restrictions, the guidelines, the what-ifs, and unfortunately that negative thinking can also snowball and be very difficult to cope with.
And it can drown you if you're not attending to it at the right time and when you need to be doing that. So, Cassey, what should people be doing if they need help during this difficult time, or if they're struggling to cope and they need to turn to someone to speak to?
I think that's the most important thing, is to reach out if you're feeling overwhelmed or anxious. And we all know there are good days and bad days. The most important thing is that you reach out, whether it's to someone close to you, a loved one, a family member. If you're not sure who to speak to, you can speak to a counsellor at SADAG. You know, there's been no disruption in our services since COVID-19. We are running our helplines 24 hours a day, providing 24-hour care, free telephone counselling and resources. If you're needing mental health help, reach out. There are still support. There's still counselling, therapy. A lot of our support groups are running online support group sessions. So there is help. And I think also it's to really urge all South Africans that if you're feeling anxious or stressed for whatever reason, really learn some good mental wellness tips to start prioritizing your mental health, to prevent it from getting any worse, from preventing your symptoms feeling worse, and making sure that you get help and support during this time as well.
Yeah, I think the bottom line of this conversation, Cassey Chambers, is that there is help. You've got to reach out. Don't suffer in silence. Don't keep it to yourself. Reach out. There are a bunch of trained counsellors out there on standby at SADAG who are waiting to listen to you, to help you, to guide you during this difficult time. And we appreciate the work that you are doing. Thank you so much, Cassey.
Thank you very much.
That was Cassey Chambers from the South African Depression and Anxiety Group, and they operate from 8 o'clock in the morning to 8 p.m. daily for anyone seeking help during the national lockdown. And if you find yourself stressed, or you find yourself anxious, or even have thoughts of suicide, remember that you are not alone. You really are not alone. Make sure to reach out to the SADAG helplines if you're finding it difficult to cope on your own. Someone's waiting to listen.